This is Dr. Maria Azizian. Today we will be discussing GI testing. Here at iLabMD, we feature comprehensive GI tests by Genova and by Diagnostic Solutions. Today I will focus on a test called GI Map by Diagnostic Solutions. I like that test because it has a very comprehensive approach to GI tract. It measures not only bacteria, parasites, fungi, etc., but also focuses on some biomarkers, which are extremely important for a variety of autoimmune and inflammatory conditions. But again, first things first, what are the indications for a comprehensive GI test? Before I get into that, I would like to say that all of the tests are done on a sample of the stool, so which makes sense, obviously. So the first group of people who would benefit from this test is people who suffer with GI symptoms such as diarrhea, constipation, nausea, vomiting, abdominal cramps, pains, etc. And in that group, we would add people with IBS, which is irritable bowel syndrome, and also IBD, which is inflammatory bowel disease. Inflammatory bowel disease is composed of Crohn's disease and ulcerative colitis. And those conditions, those both diseases, they are immune in nature. Interestingly, that GI tract and physiology of GI tract is closely connected and influenced and influences other immune conditions. So this testing is done in many other immune diseases. Other area and other group of patients who would benefit from GI testing are the patients who have skin issues such as psoriasis, eczema, atopic dermatitis, hives, and more. Those are conditions that are often not intuitively associated with GI testing, but in reality, in many cases, they are. And another group is people who are suffering from depression and anxiety, and that group of people also often is very surprised to discover that the cause of this mood disorder could be lying in their GI tract. So going forward, once your stool sample gets to the lab, what is happening? So what is being tested? So I will go over an important aspect of the GI map test, which is a test by Diagnostic Solutions. And I will first go very gently into this interesting topic. That this topic could be overwhelming, so I will be going gently, and that is that what is a pathogen? I'll start with that. What is a pathogen? Because we use that word in medicine all the time. Say pathogenic bacteria. What is this? Pathogens, that, bacterial pathogens, etc. So pathogen is an organism that is bad for us, the organism that hurts the host. So both bacteria and parasites and other fungi, they could be pathogenic or not pathogenic. So first things first, in those tests, in any comprehensive GI test, first we look at pathogenic or bacteria or bacterial pathogens. Some of these bacterial pathogens are known to you because they are very well known, and they're in all sort of magazines that you read, how to treat E. coli infection. So E. coli is one of these pathogens, and people often get E. coli UTI, more common in women, but not limited to women. And E. coli, of course, is bacteria that lives in the stool. So different strands, different species of this bacteria, they are pathogenic. So that's E. coli bacteria, very well known. Then we have Salmonella, Yersinia, and another bacteria that I'm very closely acquainted with is Clostridium difficile, or C. diff, it is called. C. diff bacteria is very interesting because it has direct correlation with taking antibiotic, and it is well documented, and it's a part of medical education that unfortunately, when we have a patient, often elderly patient, who's been on a lot of antibiotics for, let's say, pneumonia and urinary tract infection and something else, these types of folks are very prone to end up having C. diff, colitis. Colitis is inflammation of colon, and when you have this C. diff colitis, that's a very, very unpleasant and sometimes catastrophic condition. And in rare cases, when colitis becomes severe, it results in perforation of colon, and in that case surgery team is called and patient ends up having an emergent surgery. So that's why I said, as a surgeon, I'm acquainted with this bacteria very closely. So the test, this is one of the bacteria that is tested. Of course, it is very important, especially in the harm that it can cause. Other pathogens are parasites, and some of them are Entamoeba histolytica, which causes amoeba infestation, not as common, but still is still seen. Giardia, this is much more common parasite that we see. Additionally, there are viral pathogens such as norovirus and adrenoviruses. So, and when people have pathogens, or like when these bacteria are discovered, so these pathogens, they usually create symptoms, create problems. There is some cohort of people that may be asymptomatic, but usually by default, when you see those pathogens, they are not asymptomatic. Another component of the testing, which I should probably mention right now, is the quantification of these microorganisms, because it does matter a lot what is the quantity of a certain bacteria. If you have a low quantity, it sometimes could be dormant and not cause any symptoms. But if it's a high burden or high volume of this bacteria, then unfortunately, no, it will become symptomatic. The next step is the next testing point is H. pylori. So H. pylori is a common bacteria. It has various strands and species, and with H. pylori, it is well known in general public, again because it is associated with stomach ulcers. And H. pylori is often tested by, there are several tests for that, including breast tests, but here we're testing several species of H. pylori, as not only it can cause ulcers, it can cause gastritis. Unfortunately, H. pylori is also linked with stomach cancer, so it is important in its badness, so to speak, bacteria. 50% of population have H. pylori, and if they have more innocent species, so to speak, they may be completely asymptomatic with that. And if they're asymptomatic and the species are not particularly virulent, not a bad species, then sometimes no treatment is necessary for that. In another interesting fact is that when H. pylori infects your stomach lining, first it actually causes decreased acid, because I say that because people often correlate H. pylori with high stomach acid, which is true, but it doesn't happen right away. The first step is the low acid, and then it turns into high acid. And interestingly, that both low acid and high acid conditions are bad for us. So, but we hear more about high acid and, acid in my throat, the stomach acid, we hear the GERD and all of these symptoms, but they interestingly start with the low acid. So H. pylori is tested. The next group of bacteria are commensal bacteria, and commensal bacteria are our good bacteria, bacteria that protect us. So what do they actually do? So what they do, they take energy, they take nutrient from our diet and actually extract that to be used by our body. So they help us in transporting and utilizing the good parts of our diet. Additionally, they preserve they preserved our gut so that we don't get the leaky gut. So they preserve the function of the gut by keeping it intact. Also, they participate in producing vitamins such as biotin and vitamin K. Additionally, they are, of course, protecting us from pathogens, as we described earlier. In the group of these bacteria, we see Bacteroides, we see Enterococcus, but a lot of you probably recognize Lactobacillus, because Lactobacillus is the bacteria that is a part of probiotics, and that's what you see in on a probiotic bottle, or if you buy some Greek yogurt that has that. I always recommend it to my patients. If when I have to put my patients on antibiotics, and that happens, of course, I always ask them to eat Greek yogurt with this live cultures, including Lactobacillus, but preferably to take probiotics. And some people like one option more than the other, and some people do both, and that's actually the best. So commensal bacteria are good bacteria, and those are bacteria that we need when we develop a leaky gut. So supplementation with this bacteria comes into light when we get our report and we see that, oh, we're low, or this bacteria is almost wiped out. Then that's when it's important to supplement. So it helps your clinician so much to know, based on this report, that, oh, this is not enough, so we should supplement that. So you're not taking some supplements blindly, but you're taking it because you know what you're missing, you know what's lacking. So our next next component of GI map is opportunistic overgrowth microbes. So these microbes, there are this bacteria, they're basically sitting dormant, sitting quiet until something bad happens, and then they start multiplying, they start increasing, and then they attack you. That's why you mostly see those bacteria in immune suppressed people, in elderly, and usually it's elderly people who are at the nursing home, or who have multiple medical issues, and often they are in the hospital. So this bacteria basically is taking advantage of this immune suppressed state. And when that happens, they can cause lots of problems, of course, and they can cause GI symptoms such as horrible diarrhea, abdominal pain, and even constipation. But more often, of course, you see diarrhea in situations like that. And I don't need to say that, but I will say that in elderly patients, the balance of fluids and of the body composition is very, very fragile. So when an elderly or immune suppressed patient starts losing a lot of volume by having diarrhea, they also lose vital for life electrolytes that can actually lead to severe abnormalities in electrolytes, in the potassium and sodium, etc. And unfortunately, that can have very bad repercussions for such patients. So that's why this is not a minor condition at all. So these bacteria, they start overgrowing, and they basically, like I said, taking advantage of a poor host. And what can trigger them? Lots of things. Poor diet can trigger them. Usage of antibiotics can trigger them. Earlier, I mentioned C. diff bacteria, how it is connected with the usage of antibiotics, because they wipe out the normal bacterial flora. But I can say that about many of opportunistic bacteria, because they do come into play when patient has taken a lot of antibiotics, and that creates a very difficult situation for us, for clinicians, because sometimes we see these patients who are very resistant in taking antibiotics. However, they truly need it, because there are situations, especially severe infections, surgical and medical conditions, where in this day and age, that's all we have that will save their life is antibiotics, often coupled with surgery. And when people refuse to do that because of these opportunistic bacteria, I understand that. However, everything has its precedence. So that's why everything needs to be discussed and everything is individualized. Like for this patient at this point of time, even understanding that there's this bad bacteria that can basically blossom from the antibiotic will save lives. So that's why the point of my discussion is not to be against antibiotics. I prescribe them myself, but to have an understanding, not that not every little condition should be treated with an antibiotic. That save antibiotics for serious condition, but honestly, just discuss with your provider, discuss with your clinician, and don't make those decisions purely by yourself, because sometimes it's hard to understand the balance of pros and cons of antibiotics. So we have this opportunistic bacteria, and another trigger is, of course, decreased immune function. Decreased immune function could mean anything. It's actually almost like a such a big sort of blanket of things that we can put under. But one of them, I don't want you to forget, one of them is stress, because stress leads to decreased immune function. So that's why stress management is so vital in functional medicine. So it's not, everything is interconnected. This bacteria, we're in this conversation about bacteria and this little pieces of knowledge about this vast GI gut, but yet do not forget about your well-being and about your stress management. So then, of course, there are inflammatory and autoimmune related bacteria that are at the same level of harm that they can cause. The next group of organisms that is being tested is fungi. Fungi are not, the presence of fungi in a stool sample is not always really bad. It all depends how much there is, because they're very often found in a GI tract. However, if there is a fungal overgrowth, then of course that's a time to be concerned. And candida is one of the fungi species that you see in the large intestine. And of course, overgrowth of fungus needs to be treated. Sometimes it's very hard to diagnose. The reason it's hard to diagnose, again, because presence of fungi in the stool is not that abnormal. So to quantify it, is very important. That's one of the reasons why I like the this GI map test, because it quantifies things, and that makes life very much easier in terms, especially in terms of management of the microorganisms. The next group of microorganisms that could affect us is viruses. Viruses are, for example, cytomegalovirus and EBV, Epstein-Barr virus, so CMV and EBV. Very interestingly, but not a coincidence, that those viruses are associated with chronic fatigue syndrome. Do you see the connection here? So, yes, so that's another part of the GI testing. Moving on, we have parasites, and parasites actually are more common than what people think in the Western world. They are seen along with parasites, which a lot of people know. A lot of people think of parasites as worms only. There are also organisms called protozoa. Protozoa are one-cell organisms, and usually they function as parasite, meaning that they survive at the expense of the host, robbing the host organism of their food and energy. So we have both protozoa and worms that are studied in this test. And then we come to intestinal health markers. This is a hugely interesting field, so I will just say a few words about some of them. So there are markers of digestion. So there is this marker that's called steatocrit. Steatocrit measures fat in your stool. If you have a lot of fat in your stool, that means that you're not absorbing the fat that you're eating. And that is usually indicative of the fact that your pancreas is not functioning normally. So there is a pancreatic insufficiency. sometimes you can also see that in celiac disease. If that happens, that's a very good clue for your clinician to know where to look for the cause of your symptoms. So that's not a minor marker. The other marker is elastase. Elastase is also related to pancreatic function. And if you see an elastase that is abnormal, that's when you know that, again, you need to focus on the study of pancreatic enzymatic functions, because our pancreas has two functions, endocrine and exocrine, and this is a focus mostly on its exocrine function. So the next is GI markers. For GI markers, we have beta glucuronidase, which is very important in taking care of the toxins, because the toxins bind to this product of beta glucuronidase. So to see that, it indicates how your it helps us assess the protective function of the gut. So that's an important marker for leaky gut. And you see there occult blood. Occult blood is the presence of blood in your stool, and that's the test that's done widely by itself as a singular test. It's very important, as it may be an indication of oncology of colon malignancy. Immune response, the next section. Immune response includes immunoglobulin A. I want to focus a couple of minutes here on the eosinophil activation protein, EDN. So this protein, it reflects eosinophil activity, and by itself, just as a marker, it's a marker of immune functioning of the gut. However, it can also be correlated with presence of parasites. It's a secondary marker for the presence of parasites. And additionally, you see that elevated in people with allergies. So that's another very important secondary correlation from that marker. And finally, the biomarker of inflammation is calprotectin. Calprotectin is becoming more and more important in detection of colon cancer. It's not considered the biomarker for colon cancer, but for example, if you have this test and you have both occult blood positive and elevated calprotectin, that means that you are more likely to have some kind of issues with your colon, and those issues may be related to colon cancer. I wouldn't go and say you necessarily have a colon cancer, because there could be other conditions that can cause that. But this is something that clinician should start a workup for. First things first, I would immediately recommend that patient undergoes colonoscopy just based on these markers, if you have elevated occult blood and abnormal calprotectin. So, and that's for biomarkers. And a final biomarker that I will briefly mention is zonulin. Zonulin is a protein that is responsible for junctions. They're called tight junctions in the lining of the gut. So if those tight junctions are not functioning well, then you have increase in zonulin. So zonulin is now representing a leaky gut. It is a very simplistic explanation of zonulin, as not to confuse you, zonulin is also present in certain foods, and that's not necessarily a bad thing in that way. However, in testing of the stool, in a testing of the gut physiology, zonulin represents a leaky gut. So this is the GI testing in a nutshell. Thank you very much for listening. Until next time, bye-bye.